It's 7:51 and 51 degrees outside. Joining us now is Dr. Don Corenman. He's here to tell us a little bit about back pain. So many of us have experienced lower back pain, maybe leg pain, and then the fear factor sets in. What does this mean? Am I going to be paralyzed? What's going to happen? Well, Doctor is here to tell us a little bit about this and sort of dispel all these fears around the spine. So thanks for being here this morning.
It's my pleasure. Thanks for inviting me.
Well, what is it? What is it about the spine that gives us such fear? I mean, I know that paralysis comes to mind. I mean, if anything starts to go wrong, worst case scenario starts to take effect. Why is that?
Well, the spine, of course, contains the nerves and contains the spinal cord, and people have this mysterious fear of it, and there really shouldn't be much to it. It's just a simple neurologic connection, just like a wiring system that needs to be maintained.
Well, and I have to say, we were just talking about this on a personal level. My father just had spine surgery, and they sent the word to me. What I was trying to say, how do you say it? The laminotomy. Laminotomy. Large word, scared me, and I immediately thought, oh my gosh, he's going to be in surgery, he's going to be in the hospital for days. But I was then able to look it up online, and it dispelled a lot of those fears. So how is that changing? How is your forum and your website going to change that fear?
Well, what I've tried to do is explain in pretty basic terms what happens when you have an injury and what you can do to get better. And most of the time you really don't need surgery. But when you do, the surgery is pretty simple generally and mechanical and very helpful. And if you have an idea of what the surgery is and what you're getting into, and you can actually look at a video of the surgery, it makes it a lot easier to understand.
And what are you finding that people are asking on the forum?
Oh goodness. Well, the forum is a little different. I have videos that I've actually recorded problems with disorders and things of that nature and surgical videos. Then I've started something called the forum where you can actually ask questions. And apparently there's a lot of people in the country who don't get those fears dispelled, and they can write in and they can ask these questions and I can answer them, and those resources can be there for other people to read later on.
Oh, that's great, an open forum in a sense. And you're unique in the sense that you have two degrees, would I say degrees? that only one other person in the nation has, right?
Well, I try to stay out of trouble, so I've been in school a little too long. So I did a Doctor of Chiropractic degree and then went back to my medical school residency fellowship, and I'm now a spine surgeon also.
And now, how does that give you an advantage? What do you think that gives you?
Well, if you, let's say, look at a chiropractor, he's really good at taking care of all the conservative aspects, how to treat somebody up until the point of surgery. The surgeon knows how to take the person who needs surgery and go that extra step. But there really wasn't anybody who could actually know the conservative aspect and the surgical aspect and then put it all together. And that's why I've written a book, so I could have people understand the whole spectrum of back care.
Oh, that's wonderful. And as far as being able to actually get an appointment with you, is that possible, or are you mostly just information?
No, you can call the office over at the Steadman Clinic. If I can, the number is 970-476-1100, and just ask for me, and they'll probably be able to find me, I think.
Okay, so start with the website, which is www.neckandbackpain.com. We were saying you might not need the www.
Close, but it's neckandback.com.
Oh, neckandback.com is the spot to go. We can also get your book. Where is that?
Amazon, local bookstores, it's around.
Okay, great. And we can also give them a call at the Steadman Clinic. Again, that number is 970-479-5895. Thanks for being here with us today.
It's been my pleasure. Thanks.
All right, we'll be right back.